I'm Dr. Wooten, and I'm a board-certified plastic surgeon. Many of our non-surgical procedures that we perform in the office include a variety of injectables that are performed by me and my physician assistant, Marissa Casoli. When we perform these injections, it is of utmost importance that our patients are as comfortable as possible and leave our office with a minimal bruising and no downtime. In order to achieve our desired results, I adopted a new innovative technique that involves dull cannula, which we have been using in our practice for the last several years. I would like to explain to you how this technique is different from the sharp needle technique. So this is the dull cannula. As you can see from my touching the very tip of the cannula that it has a dull blunt tip. When the cannula goes through the tissue, it uses a threading technique instead of sharply perforating the tissue. A sharp needle can possibly cause trauma to the nerve or vessel along with inflicting pain on the patient, while the dull cannula threads through the tissue and evenly deposits product in the targeted locations without causing trauma. It's critically important to use the right filler in each area of the face. For example, Restylane should be used in the subbrow and the area around the eyelid to produce smoother effect and allow less swelling after the procedure. Meanwhile, Radiance, Sculptra, or Voluma should be injected in a deeper plane to give more volume to the face. I personally like to inject Juvederm around the mouth and Bellatero type filler for vertical lines around the mouth to prevent lipstick bleed. As I'm threading the dull cannula through the tissue, I'm actually gliding it against the structures that have less resistance compared to other structures that have most resistance. And when I find exactly the spot for injection, I'm starting to inject the filler. Notice that this patient is not been anesthetized and she has very minimal discomfort. In today's busy society, many patients just simply don't have the time for lengthy surgical recovery. So they're opting for less invasive methods of facial rejuvenation, such as fillers and wrinkle relaxers. The plastic surgery industry has started calling those injections liquid facelifts because they're able to show some similar improvements to surgical procedures. These liquid facelifts give patients opportunity to look and feel better about themselves without any speed bumps thrown into their daily routine. This, as well as the comfort and the accuracy in injection, is why we choose to use the dull cannula technique, offering more options to our patients.